54 years old, and this back pain came out of nowhere.
From aching backs to throbbing knees, middle aging is not for sissies.
Never at the age of 57 did I have in my wildest dreams that I think I'd be having a total knee replacement.
From surgical saws to muscle maintenance, explore ways baby boomers face the inevitable. Middle aging, aches and pains. Funding for the special health program Middle Aging, Aches and Pains comes from the Dr. Donald Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, the Margaret Clark Morgan Foundation, the McGregor Foundation, the Sisters of Charity Foundation of Cleveland, the Woodruff Foundation, the Community Foundation of Lorain County, and the United Black Fund of Greater Cleveland, Incorporated.
When World War II ended and the troops came home, a baby boom began. The rise in baby making continued for nearly 20 years, producing 78 million Americans. Now the leading edge of the so-called baby boom generation is crossing into senior citizenship. Most, though, are smack in the throes of middle age.
There's more creaks and groans. The knees creak a little bit more when you go up and down the stairs, and the elbows creak and crackle a little bit more.
The reality of aging is hard to take for a generation weaned on the exuberance of the 60s, who've always thought of themselves as special. Many boomers go to great lengths to stretch the normal limits. That's led to high-level sports and fitness activities and injuries, something now referred to as boomeritis.
We see patients that come to the office in their 60s that are training for marathons that we never saw in the past. And so the body, as it ages, is less capable of dealing with this stress. So we're seeing a lot of arthritis and tendon injuries and muscle injuries that we didn't see typically years ago.
While some boomers stay fit and feel young, others are just plain out of shape, which is murder on middle-aged joints. For an inside look at the most common trouble spots in middle-aged skeletons, we turn to the world-famous collection of human bones at the Cleveland Museum of Natural History. The museum houses the largest modern documented collection of human skeletal remains. About 3,000 or so are contained in these drawers. When you open a middle-aged drawer, what are you almost guaranteed to see?
We're going to see some kind of degeneration in the vertebral column, in the spine.
Problems with the vertebrae are indeed very common, with 75% of all doctor visits for low back pain made by young and middle-aged adults. The knee is another sore spot.
The knee is where the femur meets the tibia, which is the shin bone.
It reigns as a common site for debilitating osteoarthritis, the wear and tear form of the disease that stems from thinning cartilage.
You can think of the cartilage like a shock absorber. With the stresses that come across the joint, the cartilage takes these stresses and protects the bone and keeps you from wearing it out in other areas.
When the cartilage completely wears out on the bones of the knee, it leaves the lower thigh bone or femur rubbing against the top of the tibia. Compared to a smooth, healthy femur, a severely arthritic one looks rough and porous. 20 years ago, Dr. Roland Moskowitz of University Hospitals and Case Western Reserve University School of Medicine discovered the first genetic defect associated with osteoarthritis. While the disease tends to run in families, overuse of joints and obesity also put people at risk.
1 pound extra of weight is like 5 pounds extra stress across your knee when you use the knee. You're multiplying that by 5 times just by having that 1 pound extra.
Other age-related changes to the musculoskeletal system create additional problems. How do tendons and ligaments fit into this whole picture?
Tendons connect muscle to bone.
And then ligaments connect bone to bone.
Yes. So ligaments are more like a stabilizing element, and tendons are helping with the pull.
Tendons and ligaments are primarily composed of a protein called collagen, which changes with age.
And under the microscope, collagen would look like ropey molecules. And as we age, these ropes connect to each other and become stiffer. So we stiffen up.
And if that's not enough, here's another sad fact. Beginning around age 30, we also start to lose muscle mass.
With increasing age, we tend to lose a percentage or two of our muscle mass each year, and that's related to both metabolic and activity levels, both within the muscle fiber itself and within the body in general.
So with age, our muscles lose mass, our bodies feel stiffer, and our joints may become arthritic.
Good. Foot in, foot in.
Nowhere are the effects of osteoarthritis more debilitating to the point of needing surgery than in the human knee. Between 2005 and 2030, the number of total knee replacement surgeries is expected to increase sixfold.
Which knee are we doing today?
We're doing the left knee.
Okay. And who's your surgeon?
Dr. Barsoom.
Okay.
Now, we're going to spend some time in the operating room and witness the latest and greatest technology to quell the pain of screaming knees.
All right, very good. So, this is Mr. James Latza. We are doing a left total knee replacement. His incision is already marked, site's already marked.
These days, baby boomers like 57-year-old Jim Latza are among the fastest growing segment of the population undergoing knee replacement surgery. Latza has debilitating osteoarthritis.
So that lack of a space means that the cartilage is actually all gone. As the cartilage disappears, the space narrows, and you end up with bone-on-bone arthritis.
So that's what's giving him the pain.
Well, that's exactly right.
Are you nervous a little bit?
You know, no more than just the unknown.
It's been going on for a couple of years, and we couldn't go for walks. We couldn't go bike riding. We go to the mall, go shopping, do all the fun things we still like to do.
Before we talk about knee replacement, we tell folks try to lose weight, think about altering your lifestyle, think about injections, anti-inflammatories. So there's a whole litany of things that we try before surgery, and really once all of those things fail is when we start talking about a knee replacement and the actual surgery itself.
You know, anytime someone goes to surgery, you worry. I have a lot of faith in God, so that gets me through.
We're pushing the blood out of the leg, and now we have a tourniquet up, so we don't lose blood during the procedure. Can I get a deep knife, please? Making our incision through the skin.
If you're squeamish, now is the time to take a little break because this operating room is about to become a makeshift construction site. Dr. Barsoom will remove sections of bone from the top of Latza's tibia, the bottom of his femur, and the back of his kneecap. He'll place a prosthetic device over each part, like capping a tooth in 3 different places. And he'll insert a white plastic piece to cushion the metal between the implants.
We're going to make 5 cuts. So this is the first one. So here's the kind of thing that we got out. So here's that naked bone.
That's where the cartilage is totally torn out?
Correct.
With the last of the femur parts gone, Dr. Barsoom tackles the tibia.
This is the top of the tibia. This is going to go into the jar with the rest of the bone.
Dr. Barsoom is performing what's known as quad sparing surgery, which is a newer, less invasive procedure than the traditional approach because it lessens trauma on the quadriceps muscle group.
The advantage is afterwards the quad strength remains about what it was preoperatively.
Jim, how are you doing?
I'm doing just fine.
In the middle of all this comes the real shocker. Latza is awake, but he's numb from the waist down and sedated with relaxation drugs. Surgeons at the Cleveland Clinic do about 99% of total knee and hip replacements under a spinal anesthetic, which is safer for the patient than general anesthesia.
But he's not feeling any pain, he's numb. Absolutely not.
He's numb from a little bit above his belly button down. So it's really just sedation to keep them comfortable if the noise is going to bother them.
Soon it's time to try on the new parts.
And we look and see. Is his leg straight? It is. Does it straighten all the way? It does. And I love it. It feels great. So this tibia is just a little too small, so I'm going to go up a size.
While the femur piece is a fit, the tibia needs to be bigger. 20 years ago, doctors rarely considered joint replacement surgery for a patient in his 50s. The artificial part simply wore out too quickly, requiring the patient to undergo a second and more risky procedure later.
So we have a 40-millimeter patella, an 8/11 tibia.
But these days, thanks to advancements in materials and implant devices, modern replacements are expected to last an average of 15 years. With newer materials, the hope is longevity may stretch to 20 or even 30 years. But orthopedic surgeon William Stanfield says it's important to note there's currently no real-life data to back up 30-year knees.
With the younger patient population, we're using newer techniques with minimally invasive surgery and newer biomaterials that in the lab have been shown to potentially last longer. But in real life, we don't know just yet because they haven't been around long enough for us to see the long-term outcomes of these implants and materials.
Efforts are now underway to establish a national registry to collect long-term data. In the meantime, experts say younger patients should exhaust all other treatment options, then decide if the benefits of surgery outweigh the risks.
You don't do it unless you feel that the gains outweigh the risk, because there's no question you can get infections, you can have failure of the joint, you can have people die from the surgery.
Nancy Latza says surgery was the right choice for her husband, who is at the end of his rope with pain.
As time went on, I could just see in his face that it was wearing him down.
Back in the operating room, Dr. Barsoom is now at work on Latza's kneecap.
So here's the kneecap. This is the back of the kneecap.
Wow, that's the back of the patella. And
That's
now
right.
are you going to make your...
I'm going to make a cut there. Well, that's a pretty worn out knee.
With the back of the patella now in the collection jar, the end surfaces of each bone to be capped are cleaned and prepped. Dr. Barsoom mixes up bone cement, which acts more like a grout.
So that you're going to paint that glue on the top of the tibia.
That's right. We're going to do that right now.
That's the top of the tibia. Then.
That's the top.
All the pieces and parts are safely secured.
So now it's locked in.
Just 1 hour after starting, Dr. Barsoom lets his patient know everything went great.
There we go.
Has it been weird to be awake for this whole thing?
Yeah, somewhat, but on the other hand, you feel like you're more a part of it, and that it was funny. I thought I might get upset when I heard the saw and stuff like that, but I didn't, because you can't feel anything. So it's just like another sound in the room. It doesn't really occur to you that they're cutting something away down there.
As the surgical team closes on Latza, the big question is, what about pain when the spinal block wears off?
There's actually a catheter that's by the femoral nerve, which Jim will be able to hit a button and it will cause the medication to help keep his leg numb, basically. The scarring should be minimal with the way that we do the closure. And we are right at about 5.5 inches. So that's a nice small incision for a total knee replacement. Once he goes home, a physical therapist will come to his house daily.
The truth of the matter is the rehab is the most important part of this procedure. The rest of it really sits in the hands of the patient. You have to be actively involved in your rehab.
Off to the recovery.
We'll check in with Jim Latza later. But first, we turn our attention to another trouble spot in the boomer body.
Lower back pain is one of the most common reasons that middle-aged adults visit the doctor, and is the #1 reason for missed days from work in adults.
Yeah, I'm going to check the date on your ID card.
As front desk manager at the Cleveland Heights Community Center, 54-year-old Sandy Mates works in the perfect place to stay in shape. With the gym upstairs, Mates works out at least 5 days a week. That's why she was caught off guard with lower back pain.
Got out of bed one day and the back pain just seized up on my left side and went across to the middle of my back.
Mates' pain came from her joints. Most people don't realize the back is comprised of tiny little joints that literally carry 33% of the load of the spine.
The spine is comprised of many little joints all the way down. What they do is they link one vertebrae to the next vertebrae, and they create movement. Can you bend to the left here?
Just like people get osteoarthritis in the knee joints, people like Mates have it in their back joints due to thinning cartilage on the vertebrae, the bones of the spine.
Like any other bone, they have cartilage on the end of them, and the cartilage wears down with extreme loads and stress.
Other causes of back pain involve the discs, which act as cushions between the vertebrae. With age, discs start to degenerate.
They tend to have less of a cushion. They tend to flatten more, mainly because they lose the water in them. As we age, we go from about 90% water in our disc as we're children to about 70% when we hit middle age.
I want you to push down into my hand and hold this for 3 seconds. Okay?
For Sandy Mates, relief has come with physical therapy sessions to strengthen the core muscles that support her back.
Strong abs and strong buttocks is really what we look at. We talk about our core muscles being these array of abdominal muscles we have, along with our glute muscles.
Treatment also focuses on maintaining correct posture, especially at work.
You catch yourself hunching over, and then you have to tell yourself to sit back up straight.
Exhale, pull in, bring it down.
Fitness and wellness coach Gina Schaefer says the best way to counteract the stress we put on our bodies all day at work is with exercise.
If you're in this position all day, you need to do a lot of stuff in the back when you get to the gym. If you're always on the left side for your job, then you better work your right side when you go to the gym. Keeping yourself in good alignment is the key, like making sure you have a good pelvic tilt, keeping your upper body posture right, trying to keep your body strong to hold yourself up with your muscles, not quite so much with your bones.
Exercise also helps people lose weight. Being overweight puts lots of extra stress on the spine.
Let's just say you have 40 extra pounds on your body, mostly in your gut. How are you going to hold yourself up when you're front loaded like that? Okay, what's it going to do? That's going to give you that pounding into your discs every single time you take a step when you have 40 extra pounds on your body.
5 years ago, Sandy Mates lost 40 pounds. Mates knows her back problem would be even worse if she still carried the excess weight, which takes a lot of work to keep off.
As a middle-aged woman, you really have to try really hard to work out, exercise as much as you can, or the weight will come back on.
In fact, one recent study suggests middle-aged and older women should do 1 hour of moderate to intense exercise every day to maintain a normal weight over their lifetime.
Crunch forward. Good. Yep, as far as you can.
Mates remains determined to keep building her core and working out to protect both her back and her overall health.
Bottom line is my family, my grandchildren, keeping that weight off so I'm around for them.
Being around and mobile enough to enjoy his grandchild is exactly what Jim Latza wants to do too.
You're going to hold it for about 5 seconds, really tighten up this quad.
3 weeks after his knee replacement surgery, we joined Latza at outpatient physical therapy.
Okay, you ready to push down?
That kind of catches me right in the knee joint. The harder I push down, right in it, just a little bit over to the side from where your finger is coming. Yeah, right there.
I think your joint's still very tight.
Bending his new knee still hurts a bit. So do certain exercises.
How many did you want me to do?
We're going to shoot for, let's try 20.
Okay. I just keep trying to do everything I can to make sure that the good work that the surgeon did isn't wasted because I get lazy or I think it's all over and it's all done. To me, that's the key, exercising before and after. I tried to make the legs as strong as I could make them before they did the surgery, and I'll be back to trying to make them as strong as I can after the surgery.
Exercises in physical therapy are designed to strengthen Latza's muscles as well as increase mobility and range of motion of the new joint. Latza also knows he needs to lose weight.
I get you.
His 2-year-old grandson Robbie wants someone to play ball with.
He loves to play ball and throw the balls. We'll go to the park with Papa and throw the ball.
Latza says his family has been a great support during his recovery. So has his faith. As far as pain goes, Latza has been pleasantly surprised.
There's been some pain, there's been some stuff, but not nearly the amount of pain that I had imagined in my head.
If all goes according to schedule, 6 months from now, he'll get his other knee done.
If it goes as well as this one, I'll have 2 good legs and I'll be able to walk wherever I want again. And that's something that you can't put a price on.
Whether it's recuperating from surgery or just trying to stay healthy, we're about to see how building and maintaining muscle remains a key factor in middle age and beyond.
Really, the muscles those are your best fight against aging. That's the best thing you have for aging.
Okay, and then can I get your name?
53-year-old Annette Celestak considers herself to be moving through middle age well. As the owner of a health food store, she knows a lot about nutrition. She eats healthy and has exercised all of her adult life.
We have to know what we're putting in our mouths, and we have to learn how to move our bodies in ways that will help us age well. And you want to make sure your knees are staying on the outsides.
But recently, Celestak hit a bump in the road on her journey through middle age.
Go ahead and bend your knee up for me.
Celestak had surgery on her knee due to a torn meniscus, a common soft tissue injury. A key factor in Celestak's recovery lies in the fact she was in good shape before surgery.
Just let your hip come out into my hand here.
Over the years, Celestak's regular exercise habits allowed her to develop balance, coordination, and most importantly, strong muscles. The quad muscles of the leg help support her knee in healing. So do the muscles in her core.
It's all about working the abs and the buttocks, and everything else should fall into place. The buttock controls the knee position, and in order for that to heal, the knee has to be in good position and good alignment, and so the buttocks has to be strong.
We all know what muscle looks like on the outside. And here's what it looks like inside the body. Muscle cells are actually long tubular-shaped fibers.
Actually, the fiber itself would go in and out of this plane for as much as a foot or more.
So that's a long tube view.
Exactly. All our muscles are long tubes with many, many nuclei filled up with filaments.
But starting at around age 30, we start to lose muscle mass. Experts now suspect that has something to do with the communication system that fires messages to move muscles.
As we get older, the messages that are being transmitted from the central nervous system out to the muscle to cause it to contract and maintain muscle mass are getting weaker. The transmission is not as efficient, and the signal isn't really getting through as well as it does when we're younger.
The way to counter muscle loss is with weight resistance exercise. It sets off a series of chemical reactions in the body, which lead to the production of more filaments. So when you're at the gym and you're building muscle, you're filling those red fibers, those big circles, with more filaments.
Right, you're expanding them by adding more filaments. They get bigger and stronger.
All right, we're gonna do some abs on the ball now.
Fitness and wellness coach Gina Schaefer says it's never too late to start building muscle. The key is to be consistent. Consistent workouts force the body to adapt to the stress.
So, they're starting to study now, athletes that are 60, 70 years old doing triathlons and marathons and that type of thing. And they're holding onto their muscle pretty well. It's not like it just leaves you with age. If you work at it, cultivate it, you can keep it.
Well, you have to fight back physiology by exercising your muscle. You have to increase the time it's stimulated by the nervous system, and you have to increase the amount that it's stimulated by the nervous system.
With age, maintaining flexibility and practicing balance exercises are also important. Balance is a use it or lose it kind of thing. And don't underestimate the role of stretching.
Yeah, stretching is extremely important, particularly before sports activities, because by stretching the muscle, it helps loosen up that muscle and helps to warm up the muscles, and that can help prevent injuries during the activity.
The bottom line is staying in shape in middle age helps put you in shape for old age. Whether it's recuperating from joint replacement surgery, a soft tissue injury, or trying to stay clear of back pain, building and maintaining strong muscle is key to keeping a middle-aged skeleton aligned and able to enjoy our jobs, our sports, and most importantly, our families.
Mwah.
Rest assured, in middle age, one thing is for sure. The human body is in transition.
The eyesight isn't nearly what it was
20 years ago. A little tendonitis back here that I feel. In the back of my knee, when I run, I can feel it kind of ting. I've had some lower back pain.
Did you know that's all boomeritis?
I didn't know what you called it, but I guess I do now.
And that's what it's all about, is being adapted to change, and our bodies being adapted to change too.
To learn more about middle aging and the physical, social, and emotional aspects of getting older, visit our website where you can watch, listen, and link to relevant information and valuable resources. Go to health.ideastream.org. You'll find web-exclusive material, including tips from successful seniors that may help ease the aging process. There's links to local, regional, and national resources, plus multiple opportunities for your input and feedback. Go to health.ideastream.org. Funding for the special health program Middle Aging, Aches and Pains comes from the Dr. Donald Goodman and Ruth Weber Goodman Philanthropic Fund of the Cleveland Foundation, the Margaret Clark Morgan Foundation, the McGregor Foundation, the Sisters of Charity Foundation of Cleveland, the Woodruff Foundation, the Community Foundation of Lorain County, and the United Black Fund of Greater Cleveland, Incorporated.